So we should talk about the psychiatric mental health, right? So to deal with the psychiatric patient, it is not easy because I want to tell you they are basically innocent because their brain does not know what they are doing. So there are so many psychiatric problems like personality disorder, example, paranoid, then schizophrenic, antisocial, and borderline. So psychiatric patient, when you deal with them, it is very important to deal with them a special manner. Before to start these psychiatry PowerPoint classes, I want to recap something before to go psychiatry. I like to remind something, soft reminder. When you deal with the psychiatry patient, don't forget about the patient right. Every patient has a right to get their facilities. The patient also have a right to refusal the treatment option, and you must follow and their confidentiality, right? And also whatever you did, you have to keep the note. During deal with psychiatry patient like personality disorder or psychotic disorder like schizophrenia or anxiety disorder, post-traumatic stress disorder, obsessive compulsive disorder, or other dissociative disorder, bipolar, depressive disorder, when you deal with them, you must follow the ethical principle, right? If you do not have any ethics, how you have to give the treatment with the patient? You do not have right to do this. So when you deal with them, keep in mind about the principle like autonomy, beneficial, fidelity, justify, known maleficence, or veracity. So as I told you, patient has a right to make his or her own decision, even if it is not his or her best interest, but they have a right to make their own decision, and this is called autonomy. When you deal with the psychiatric patient, you have to keep in mind about the autonomy. Second, I said beneficence. So do what is the best for the patient, means to do good. When you deal with the psyche patient, not only psyche, any patient. And also you have to keep the promise, and this is called fidelity or loyalty. Always be faithfulness. If the psyche or any other, you has to be good justice to them. Provide the fairness in care and allocate of the resources. And you never be or do no harm to the patient, and this is called non-maleficence. And always you have to keep documentation whatever you did, and you have to be tell the truth. You be honest, and honest is called veracity. So when you deal with your patient, never forget about this, right? And also it is very important, like if you deal with psyche patient, you have to find out the level of their consciousness. And some patient is too much um, aggressive, that time you need to put some restraint, but always you have to follow the principle of ethics. Dealing with the patient, like communication, it is also very important, in especially the psychiatric patient. Therapeutic communication, it would be therapeutic and effective way of communication. Defense mechanism you have to know about as well, right? So now we going to talk the disease one by one, right? One by one disease we are going to talk. And here the first disease are anxiety disorder. So everybody have anxiety in their life, right? But if you have, you should know how to deal with the anxiety. Otherwise, anxiety kill you. So anxiety is not a bad basically, but if it is mild anxiety. But if the anxiety is moderate or severe, that make a problem. Anxiety eat your brain, bite your heart, and lick your every systems. So when you deal with the patient with anxiety, not only patient, even with your life, you have to find out the level of anxiety, right? And also what are the symptoms of each level, you have to find it out. And as a nurses, what are the nursing intervention for mild, moderate anxiety? Or what are the nursing intervention about the severe or panic level anxiety? You should know. So first of all, I said the anxiety, there are three types: mild, moderate, severe, and panic level. So anxiety is a normal response to stress, a subjective experience that include feeling of apprehension, uncertainties, right, occur as a result of the threat that may be misperceived or misinterpreted. So the type of anxiety, first of all, normal, acute, and chronic. And the other hand, where we have to categorize anxiety: mild, moderate, and severe here. So let's go first here. Normal anxiety. Normal means short-term, healthy type of anxiety. So mild anxiety or normal anxiety, not bad. If you have the mild or moderate anxiety, mild anxiety, you have to speed up for your responsibilities. Like if you have a exam, you have to study because of mild anxiety, and it is healthy. Acute means precipitated by immediate loss, and chronic anxiety that persists for a long time, right? It's chronic. So the level of anxiety is very important to find out the what level it is, and also symptoms at each level. Mild anxiety, basically individual perception. The mild anxiety is almost normal experience and everybody have it. Mild anxiety can be motivating, productive, Also increase the creativities, increase the learning. I am crazy for my licensing exam, so I am studying. It helped me to step up. But moderate anxiety, problem, right? So focus on immediate concern. Moderate anxiety narrow the perceptual field. So moderate anxiety slightly reduce the perception and ability to think. Moderate anxiety patient has some symptom like they facing difficulty of concentrate to work. If you are student, if you have a moderate anxiety, it would be difficult to get concentration for the study. And also the patient increase the heart rate, increase the respiratory rate, right? Severe anxiety, perception is greatly reduced and patient no ability to problem solving at all. If you have a problem, it causes the anxiety, but if the anxiety level is very severe, basically you lose or no ability to problem solving, right? So when you have problem, you have to know how to deal with this. You have to keep focus and you have to the control to solve the problem. So basically the severe anxiety patient have feeling of doom, or they have a tachycardia, means heart rate increase. They have hyperventilation, and also they talk very rapid because of anxiety. So the other level of anxiety is called panic level. So panic level anxiety, panic is associated with the anxiety and the feeling sense of impending doom. And patient personality will be disorganized and patient unable to communicate or loss of ability to control the anxiety or increase the motor activities. I said the rapidly speech, rapidly talk, loss of rational thoughts, inability to concentrate to the work. So if the panic anxiety is prolonged, it leads to death or exhaustion. Panic anxiety, individual basically loses the touch with reality, distracted behavior. If you ask me, what are the other signs of panic level anxiety? The patient usually have a dilated pupil. Patients start hallucination. Hallucination, as I said, abnormal, false perception, belief. Also, patient has a severe withdrawal, or they have a severe shakiness. So it is the sign and symptom of anxieties. So if anybody have the anxiety, what are the nursing intervention, right? Nursing intervention for mild, moderate anxiety or severe or panic level anxiety, what you should do with our patient. So basically, generalized nursing measurement first. Recognize the level of anxiety, make a good communication, trustable relationship with the patient, right? Protect your patient. If patient have any danger like suicidal ideation or harmful for themselves or aggressive, you have to keep a quiet environment, safe environment, make sure somebody with them. Maybe the patient room should be close to the nurse station, and never criticize them. Protect, do not criticize. Teach how to cope mechanism. Teach how to get confident or concentration. Do not force the client if they don't like to do something. Modify the environment means quiet. Provide creative outlet. Provide activity that is limit the amount of time to destructive activities. So what are the intervention for mild to moderate anxiety? What intervention for severe anxiety? We are going to talk about this. In case of mild or moderate, so active, we have to introduce ourselves with the patient, whatever it is. Then what the patient want to say, you have to listen very carefully. So patient will think, yes, they are important. So active listening is super important to dealing with the patient. Evaluate the patient's past coping mechanism. You ask to find out the problem. You asked their past medical history. Also, you have to ask to find out what are their coping mechanism they follow for before, like relaxation technique. Take a deep breath or breathing exercise. Monitor vital sign. Admin anti-anxiety medication like benzodiazepine. Immediate nursing action is important. In case of mild to moderate, again, assist the patient with problem solving. Teach the patient how to do the relax. Always you tell your baby, read, 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 or read with concentration. Did you teach your baby how to practice to increase the concentration? Every day you telling your baby, read with concentration, read with concentration, read with concentration. But did you give any pathway how to do the increase the concentration? No. So always you have to, when you deal with patient, you say relax, relax, but you never explain how to do the relaxation techniques. So you have to teach relaxation technique. For example, abdominal breathing exercise, deep breath exercise, encourage the exercise to reduce the anxiety, right? So encourage the client to talk about their feelings verbalized. Encourage the problem solving, encourage the gross motor activities so they can easily tell what is their problem or how they feel. So what in case of severe to panic anxiety, how we have to deal with them. Reduce the anxiety underlying cause, use a clean manner, always remain with the client, minimize environmental stimuli, Provide clear, simple statement. Don't tell anything complicated, right? Use the low-pitched voice. Attend to the physical need. Provide gross motor activities. Administer anti-anxiety medication as prescribed, right? So here the severe anxiety, we have first, I'm just summarized it. In case of severe anxiety or panic level anxiety, we have to provide a quiet environment with a minimal stimulation. This you have to know for board exam. And remain with the patient, because some patient has a chance of suicidal, because some of them have a suicidal ideation. Some of them are aggressive, harm for themselves. So remain with patient. Set limit with short or simple statement. Help the patient to focus on reality. Problem solving is not realistic at that level of anxiety. So like you go and do something magical, it is not, right? First of all, tell them to be quiet. But therapeutics relationship is super important to dealing with the patient, and also transform the message to the patient. It is also very important level. And also the psychiatry patient, you have to know how to prevent the injury, right? So basically, as I told you, when we deal with the patient, we have to know how to orientation, how to working, and how to even termination. And all of these are therapeutic relationship with the patient. Generalized anxiety disorder, basic talk about this. Generalized anxiety disorder is an unrealistic anxiety about everybody, or that persists over time and is not associated with another psychiatric or mental disorder. What are the physical symptoms of generalized anxiety disorder? Usually patient restlessness, episode of trembling or shaking, chronic muscle tension, dizziness, inability to concentrate, chronic fatigue, also inability to recognize the connection between anxiety and physical symptoms, because they lost the relationship with realities. Panic attack, basically panic attack patient, panic disorder produces sudden onset of feeling or of intense apprehension or death even. The cause usually cannot identify. It is severe, recurrent, or intermediate anxiety attack and lasting 5 to 20 minutes. If anybody have a panic attack, they usually came with a sign and symptom like they feel suffocated, choking sensation, stoppage of breathing, pounding heart, palpitation too much, chest pain, dizziness. Sometimes patients say, I do not know how I feel, or I don't know how I will explain my condition, right? Very bad situation. Generalized anxiety, other sign symptom, nausea, patient is sweating, is called diaphoresis, or patient feel numbness, abnormal tingling sensation in extremities, means foot or legs, a sense of unrelated or helplessness, a fear of trapped or fear of dying. They feel they're going to die, right? They feel they're going to die. And what the other intervention in case of panic disorder? So remain with the client, attend physical symptoms, assist the client to identify the thoughts. What are the abnormal thoughts? Try to identify. Assist the client to change the realistic thoughts, to move the realistic thoughts, and use the cognitive restructuring or replace distorted thinking, or administer anti-anxiety medication. So this is the very basic intervention we have to follow for generalized anxiety. So as I want to recap the therapeutic relationship with the patient, whatever it is, psychiatric or medical or surgical unit. First of all, I said orientation. Introduce yourself with the patient, discuss confidentialities, and established expectation and boundaries, right? Or parameters. Always, when you deal with the patient, you have to identify the patient needs and set a goal. When you're working with them, after the setting, you have to go for intervention. So always perform ongoing assessment. Assist the patient with problem solving or behavioral change. And also evaluate the coping strategies or mechanism used by the patient in the past. Is it work or it does not work? Introduce the patient to others on the unit, and also revise the goal and plan as needed. And this is called evaluate. Support the patient use with a new coping mechanism, because they do not know what is coping mechanism. You have to educate them. Do this, do that, right? And different peoples have a different way to coping mechanism. So you have to find it out which one work for them, with them. So when we finish or at the termination, you have to summarize the goal and achievement, and allowing the patient to share the feelings about the termination of relationship. Discuss the way to the patient to incorporate the new health behavior into his or her life. All of these are the therapeutic relationship. And when you have to dealing with the patient, it is very important to deal with them. Now we are going to talk about the post-traumatic stress disorder, right? In this PowerPoint, we should talk about what is the post-traumatic stress disorder, what are the signs and symptoms or manifestation of disease, and what are the treatment options, right? So basically, the post-traumatic means after the trauma. What is trauma? Like a patient did a road traffic accident. After the very bad road traffic accident, patient is survived. But patient do not forget the incidents, what happening with him. So the symptom develop after the trauma, right? It's called post-traumatic stress disorder. Like a girl is walking at the midnight, and unfortunately she got a rape, and after the treatment she physically okay, but what about their mind? But lifelong she maybe continue these bad memories, but everybody's coping mechanism is not same. Somebody are facing another trouble with the memories, and this is called post-trauma, right? Post-traumatic stress. So what after the experiencing a psychological traumatic events, the individual is prone to re-experience that events and have recurrent and intrusive dream or flashback. So post-traumatic stress disorder, as I told you, it is exposed to the trauma or traumatic events like physical abuse, like military combat, like rape, that can cause the following manifestation like flashbacks or distressing dream, bad dream, difficulty of concentrating, insomnia, anxiety, irritabilities, detachment from others, or hypervigilance, or exaggerated startle response, and feeling of guilty or negative self-image. It is not true that every symptom will be present for every patient, right? So the trace of what they are, like natural disaster, it is a trauma or traumatic events, terrorist attack, military combat experience like war, any bad road traffic accident or any accident, any rape or crime or violence, sexual, physical, emotional abuse, most common, right? So all of these are the stressor. After this, patient feeling of guilty, they have a negative thought, negative self-image. Maybe it is my fault. Somebody cheating with you, you believed. It is not your fault. You believe they cheat with you, but you feel it is your fault. So exaggerated. Then after this, when you lost your trust, you never trust anybody. Even something is same, you behave abnormal, and this is called exaggerated startle response. And detachment from the others. Sometimes they like to withdraw themselves from the society, they isolated and they kill themselves. They victimized, but still they do not know how to cope and move on. So after the trauma, patient develop insomnia, most common. They develop anxiety, right? And this is actually the sign and symptom. As I told you, feeling guilty, Sleeping disturbance, insomnia, nightmare means distressing, destructive, bad dreams, difficult of concentration, detachment, anxiety, flashbacking from the events, hypervigilance. All of these are the sign and symptom because of trauma. So as a healthcare provider, what is your responsibilities? Or what are the intervention? Even what are the treatment option? So client dealing with the, like as an example they said, a patient is diagnosed the cancer, or a patient has a bad um, history of, like a few months ago in one of the countries called, I mean in South Asia, that plane crash. If some of the patients are survived, so but they has to carry out these memories lifelong and develop the post-traumatic stress. Even the cancer-related post-traumatic stress can occur anytime during or after the treatment. The symptoms of PTS are similar to those of post-traumatic stress disorder, but generally not as severe. So, first of all, what are the most important? This is the coping mechanism, right? So, cognitive behavioral therapy sometimes work for them, or prolonged exposure therapy, or eye movement desensitization, or reprocessing, or some of the medication also work, like SSRI, means serotonin, selective serotonin reuptake inhibitor, or tricyclic antidepressant. We will discuss in psychiatry, pharmacology, all of the medication. So what are the other treatment options for the post-traumatic stress disorder, like hypothermia, hypotherapy, or biofeedback therapy? So all of these are the treatment for post-traumatic stress disorder. Okay, now we're going to talk about the obsessive compulsive related disorder. So this is the two work together. One is obsession, other is compulsive, right? Obsessive compulsive, two work together. So patient has an obsession and patient has a compulsive activities. Patient has a obsession, means repeated abnormal thinking. Because of repeated abnormal thinking, they do something to reduce the anxiety, and this is called compulsiveness, right? So in this PowerPoint, we have to talk what it is. What is obsession? What is compulsiveness? And what are the nursing intervention or nursing care? And what are the treatment options? So shortly it is called OCD, means obsession compulsion disorder. So here you see what is obsession, what is compulsion. Obsession means preoccupation with persistent intrusive thoughts and ideas. Compulsion performance of rituals or repetitive behavior designed to prevent some events, right? Divert unacceptable thoughts or decrease anxiety. As a healthcare provider, what you should do, if your patient has an obsession, don't tell them, stop this. When patient has obsession, when they do something to stop, they do something to reduce their anxiety. As a healthcare provider, you don't tell them not to do this. Different way you have to deal with them, right? I want to give an example. Like I'm going to my office at the 9 a.m. I dress up, close my door, sit in my car, and I started to drive my car. Suddenly I stop, think I'm alone in my home, nobody at stay with my home with me at home. Suddenly I thought I did not close my door. I turn over, came again to home. I checked the door and I found the door is closed. Again, start to drive to my office and I got I-95. I driving. In between home and office, I found and realized my room is closed. I feel it because this is the abnormal thought, repeated thinking. I again turned over, started to come back, and I got home and I checked the door. Door is closed. Again start driving. After 2 hours, I got home. I'm already late to my office. I got table, started to work. Suddenly I feel my door is open. So my door is open, same repeated abnormal thinking is coming in my mind. This is persistent thoughts, obsession. When I come back, close my door, I'm doing something to reduce my anxiety. And this is compulsiveness. Compulsive is reduce the anxiety. Like COVID-19 is everywhere. I went to Walmart, came back home, wash my hand 1 time, 2 times is good. But if I randomly, frequently washing my hand more than 100 times, this is definitely not too good. But I'm washing my hand, it is reduced my anxiety. So as a healthcare provider, don't do washing your hands frequently. You can tell them, okay, you wash hand few minutes ago. Don't wash next 1 hour. So you increase the interval. You have to ensure them. You have to explain, right? So obsession, compulsive often occur together and can disrupt normal daily activities. So like I said, I late to my office because of my obsession or compulsiveness. 1 day is okay, but 2 days, 3 days, my office boss will me fire, right? Because every day I have an excuse. But psychiatric patient mental problem is okay at very mild level, but when they interfere or distract your daily life, you are patient. You need counseling, you need psychotherapy, you need psychiatric medication. So obsession or compulsion often occur together. because of compulsion, reduce the anxiety because of obsession. And I said obsession are the abnormal belief or thoughts. Anxiety occurs when one resists the obsession. Resist you means you stop the compulsion because of obsession, and it is increase the anxiety level, and anxiety is not good. Obsessive thoughts can involve issues, maybe with violence, aggression, or sexual behavior, right? And sometimes obsession because of religion, or can uncontrollable interrupt conscious thoughts and that ability to functioning or function. So as I told you, the patient has persistent thoughts or urge that cause the anxiety. The patient is engaged in compulsive or obsession behavior. Example, frequent hand wash or alleviate the anxiety, or ritual or time is consuming or limit the time for other activities. The patient is adhered to a rigid set of rules. So what are the treatment or the nursing intervention about the obsession or OCD? Basic, before to go, here's something here, related disorder, obsessive compulsive related. Like here is called substance or medication induced obsession. So if you use the heroin or morphine for a long time, you may develop obsession or obsessive compulsiveness. Obsessive compulsive and related disorder due to the other medical condition, maybe underlying cause, we have to find it out, right? So here the here obsessive compulsive pattern, here the compulsive behavior pattern decrease the anxiety. The patterns are associated with obsessive thoughts. The pattern neutralize the thoughts. During the stressful time, the ritualistic behavior increase, defense mechanism increase the repression, displacement, and undoing, right? So now we have to know what are the nursing intervention. Okay, so obsessive compulsive disorder, when you deal with the patient, what is our nursing intervention? You have to help the patient set time limit for compulsive behavior and lengthening the time between the rituals. Cognitive therapy sometimes work. So cognitive therapy to help the patient identify the sources of anxiety. This anxiety that lead to compulsive behavior. Thought stopping to interrupt the obsessive behavior, because psychiatry patient, their abnormal thinking repeatedly come. So if you divert their thinking, if you keep them busy with some daily living activities like or other exercise, relaxation therapies, some group work, right? This can help to divert their thinking, games, so many things. Also, we have to uh, provide the stopping to interrupt obsessive behavior, provide some medication, provide some medication like SSRI or anti-anxiety medication. So anti-anxiety medication or SSRI, selective serotonin reuptake, or SNRI, can reduce the obsessive compulsive behavior.